If we are able to diagnose pregnant women who are living with HIV early enough and put them on treatment, they are much, much less likely to spread the infection to their child, either while the child is still in the womb, while the child is being born, or even after the child is born through breastfeeding. And the reason is that if people are on treatment, the level of the HIV virus is much, much lower, and so it's harder to transmit the virus either through sexual fluids or blood or through breast milk. And we've begun to see that gives us a hope that we actually could eliminate new infection, HIV infection among children. And the UNAIDS, the United Nations agency that coordinates the work of over 10 UN agencies in response to AIDS, as well as the US government's PEPFAR program, the President's Emergency Plan for AIDS Relief, have joined forces to develop a global plan to eliminate new infections, HIV infections among children by 2015, and to keep their mothers healthy. We don't just want to have healthy children and then have them lose their mothers. So we need to treat both mothers and children. And there are several prongs that have been developed in this plan to be able to reach this goal by 2015. One is certainly to make sure that pregnant women are tested and put on treatment. We also want to make sure that children are tested early so that if they are infected with HIV, we could put them on treatment. And the World Health Organization has renewed their guidelines. We used to think that we shouldn't put very young children on treatment, and now we know that it's very safe for them and we can do it and we should do it. Because if children are infected and they're not put on treatment immediately, then over half of them die before their second birthday, and over a third of them die before their first birthday. With these measures in place, we really do believe that we could stop HIV infection among children, and we're working hard to do that. We've selected 22 focus countries, 21 in Africa, and the other one is India, where the largest amount, about 90% of all HIV infection in children, occurs in those countries.